Good morning, everyone. I'm Sue.
And
I'm a
Abby.
nurse. I'm a nurse, and I am not a nurse working at the front lines anymore, but I did so for quite some time earlier in my career, working on med-surg units and coronary care unit as well. So I was witness to many deaths in my day as a frontline nurse, but I never felt like I totally understood what those patients and families were going through until it happened to me, until I lost my soulmate, my best friend, and my husband, Bob Hassmiller. We were avid bicyclists, going out whenever we could. And on the morning of September 25th, 2016, I was at a meeting in Philadelphia, and he texted me that he was going out for a bicycle ride. And he said, "I'm glad you're not here because I probably wouldn't have gone. It's a chilly morning, and I know you're a fair weather biker." I told him to be safe, as we always said. And additionally so, because on that Tuesday, that was a Sunday, on that Tuesday, we were to lead a big bucket trip list where we were taking 32 people from around the country on an international tour of Clara Barton and the Red Cross. At the end of the meeting, Bob was to pick me up, and he was so excited. He was never late. He was so excited. I had finally given in to him so that he could buy that retirement convertible. And he just was a kid again, and he was excited to be in that car every moment. But when the meeting ended, I noticed Bob wasn't there. I looked down one street and then another, and I thought it was rather strange that he wasn't there. And then I turned my phone to text him, and I looked down and I noticed there had been 2 calls that came in that I really didn't recognize and didn't answer because I didn't recognize them. But when I looked at those calls coming in rapid progression, my heart sank. So I called back one of the numbers, and the voice on the other end said, "This is the trauma center." And I said who I was, and they said, "Hold on, let you talk to a nurse." So when the nurse told me to come to the hospital immediately, I said, "I need to talk to my husband first. Please let me talk to him first." And she said, "I can't reach the phone to him." And I knew then that was a lie. And I knew it was serious.
Good morning, everyone. My name is Abby Karlsson. I'm a certified registered nurse anesthetist. I provide anesthesia to a wide variety of patients, ranging from pediatric patients to laboring mothers to trauma patients. And it was in this role that I met Bob Hassmiller on a typical 24-hour trauma call with a routine number of pages to the trauma bay that turned out not so typical at all. Like Sue said, it was mid-morning on a beautiful fall day when I was called to the trauma bay as Bob was being brought in after his bicycle accident. Given the nature of the trauma bay, an array of people doing many things at once, asking many things of each other, and communicating information rapidly, the scene can appear chaotic. Yet, it's a perfectly oiled machine. The one thing, though, that always stands out is the person who rightfully has no idea how they ended up there, how the foreign environment functions, and is in a state of marked distress, the patient. Bob stood out from moment one for a number of reasons. Despite the fact that he let us know he could not feel his body from the chest area down and that his neck was sore, he had a very distinct cool about him. Aha, light bulbs later went off in my head as I read Sue Hassmiller's blog down the road and first learned that Bob had been involved with disaster relief, had military experience, and was himself a helper by nature. But I knew none of this then. Despite the strange environment, he was unusually relaxed. He was calm while he listened to the information being presented regarding the necessary next steps, the need to keep his spine completely stabilized, quickly go to scans, and the reason for needing to have a breathing tube placed to protect his airway. I did my best to reflect this calmness back to Bob and make him feel at ease as he drifted off to sleep for the purpose of endotracheal intubation. And as quickly as we met, he was whisked away to CT MRI, and I was called back upstairs for an add-on surgery.
I was told that my husband was a quadriplegic, and it was very hard to register. But when I went into his room and he saw me, he started crying. All the machines and the tubes and everything, all of my nursing experience went right out the door, and I was a wife. And when I saw him crying, I knew those tears were for me. He lived for me, he lived for my happiness. We never knew what caused the accident.
And despite my years of healthcare experience, this set of circumstances weighed heavily on me. Perhaps it is because Bob reminded me so much of my own active father, or perhaps because when I looked into Bob's eyes to explain what needed to be done, I felt a soul-piercing sensation that Bob was a wonderful man. His serene nature and smiling eyes resonated with me.
And I was in an intensive care waiting room with a friend who had come to be with me that day. And while I was there, in walked a woman in scrubs and a surgical cap, and she had the biggest eyes you'd ever seen in your life. And she hugged me. And even though I was numb and confused, I felt her warmth. She said, "I wish I could take away your pain." And she handed me some water and a snack, and I'll never forget her.
I was drawn to the intensive care unit Bob had been transferred to in hopes of connecting with his family. I met Sue briefly in the ICU waiting room and wished I could have done more to ease her palpable pain. I hoped in some small way, knowing that Bob was coherent and calm, and the time frame I spent with him before we placed a breathing tube would provide her with comfort. I told Sue about how whenever I am preparing to assist someone into a state of sleep, I tell them to think happy thoughts, let your dreams be good ones while you sleep, as they drift into unconsciousness in what I hope is a more peaceful and relaxed mindset. And that I was sure as I gave Bob these instructions and he closed his eyes, he was envisioning her. After our conversation ended, I visited the cafeteria and bought some waters and granola bars and handed them off to Sue's friend as she was on the phone. It was the least I could do, and I knew there was little more I could say or do as she was grappling with life's worst news. And this has always been the hardest part of being a nurse. In the middle of the night, up for another reason but finished with that task, I passed by Bob's ICU room. While Bob was still intubated and under some mild sedation, I saw his eyes were open. Pulled inside, I reminded him of who I was and how we had met in the trauma bay earlier. I conveyed the simple facts as to what had happened and why he had a tube in his mouth now preventing him from speaking. I also told him his wife had been there. She knew what was going on, she was safe, and she was being taken care of. I knew if I was in his position, I would have wanted someone to do the same.
Much later in my husband's 10-day stay in an intensive care unit, I heard from Abby again. I wasn't looking at emails, but I happened to see something that came in that said Abby, and I didn't forget her name because of the care she had shown me, and also, quite honestly, because she shared the name with my precious granddaughter. So her name and her care and her warmth really stuck out for me. Her words and warmth, as she got back to me through email, were like a beacon of light in the utter darkness that I now know is called profound grief. And when my husband's memorial service came up, and I had really no words to share what I was feeling, and basically I wasn't feeling, I used her words to talk to the people who had come to that memorial service today because they meant so much to me.
I didn't know Bob or Sue before this day. Bob wasn't dressed in his Red Cross uniform, and Sue wasn't wearing a healthcare badge. Neither of them revealed their identities in this regard, but they didn't need to. They were people in need, people going through the worst day of their life. And while I was powerless to fix this traumatic situation, I could try to make it slightly less painful. I was hopeful that positive updates might meet me when I next returned to the hospital, but I was unable to gather any information as I had learned that Bob had been transferred to another facility. My heart continued to ache in the coming days as I pondered over how tragic it is that a person can be healthy and enjoying life one minute and then suffer a life-changing, devastating injury the next. How unfair and unsettling. My brief but powerful encounter with Bob and Sue is what compelled me to continue to seek updates and contact Sue, despite my concern that this may be frowned upon by hospital administration. But at some point, you have to question why you became a nurse in the first place and follow your heart. And so began a series of emails between Sue and me, where I learned that my instinct in the trauma bay was spot on. Bob Hassmiller was a very special person indeed, and Sue Hassmiller was his other special half. An accomplished nurse herself, I was impressed by how Sue was able to so beautifully expose the emotions she encountered as she was on the patient side of things. And I was so grateful that Sue felt my presence in the intensive care unit waiting room and the email communication that ensued to be a positive contribution. I was deeply touched when Sue told me she read excerpts of my emails at Bob's memorial service, and I was honored when months later, Sue invited me to her home for lunch to meet her family. It was so special to see Sue again, meet their children, and little Abby, Bob and Sue's granddaughter, who showed me pictures of her pops and told me how much she loved him. This meeting between nurse and patient's family was cathartic for both sides. It could also be seen as controversial, and that's something I feel needs to be addressed and uprooted. Feeling a spiritual, personal pull to follow up and connect in this capacity will obviously not happen with every patient you encounter. This is perhaps a once or twice in your career type of situation, but when it does, wouldn't it be nice if it was supported by hospital administration rather than condemned? Human interaction is intricate and doesn't fit nicely into a yes or no checkbox, an allowed or off-limits protocol, a minimum or maximum dose. The reality is, every now and then, a very special bond is formed that overflows the professional boundaries of the confines of hospital walls and connects people in a much bigger and more important way. I'm of the camp that the fear of reaching out in this situation stops these connections from occurring, which is a tragedy of the system because it may be everything that the patient, their family, and the provider needs. Perhaps someone here will have some formal guidance on how to navigate reaching out to patients and family members in these special situations, but all I can say is that I've never regretted doing so myself.
On the second morning after my husband's accident, he was transported to a facility I was told specialized in the care of quadriplegics. So I had him helicoptered to that facility. It was a very painful time to remember, but as a loving wife, I noticed the environment that he was brought into was very sterile and very brutal. Yes, my husband got very good care, precision medicine, if you will, one body organ at a time. I remember people dressed in white coats with stethoscopes around their necks, traveling down the long, winding hallway, with patients tucked away neatly on the other side of glass doors. I was in such a state of shock and grief, but knew that the circle of intimidators, as I grew to call them, was looking only at their computers each morning and each other, then finally deciding on the next course of action. That's how it appeared to me. I wondered why they did not speak and talk to my husband. So every morning, I decided to pull up a chair in the circle of the intimidators and hold a picture of my husband so that they could all see the organs that they were talking about and what those organs looked like just hours and days before. I knew he was getting the best possible medical treatment our system could offer, but I was despondent in that new facility until Kathy came along. Kathy is the other nurse that I hold up. She's not able to be with us today. Along with the great medical care he was receiving, she truly took the time to understand who we were. She looked at the pictures on the bedside stand. She touched him in just the place where he could feel. She asked about music preferences, and it was all about his preferences, and she was the only one. She was proficient, yes, and she was compassionate beyond anything I could have ever hoped for in those last moments. And on that last night, she helped me move my 6'4", 220-pound husband to one side of the bed so that I could lay with him. And she stayed with me way beyond her shift and helped me turn off the machines. And I could never have done it without her. After Bob's accident, I decided that I wanted to change the care experience for patients and their families. I couldn't believe it when I was in the hospital and seeing how things were only, in my mind, half right. I wanted to scream to all of the other family members in that ICU waiting room who were basically sleeping there and sitting there and eating junk food and crying and watching loops of the presidential debate, desponding in and of itself. But I wanted to scream to them, you can be part of this care. I don't know how I did it, but I inserted myself, and I wish they could have done it as well. I started speaking after all of this and writing about compassion at the front lines, as well as reviewing the literature on compassion. And I learned a lot. 4 things I'll share with you. 1, besides comforting patients and their families, compassionate care can decrease a hospital's costs and improve outcomes. 2, when patients believe they have a good care experience, healthcare organizations have lower readmission rates, shorter lengths of stay, fewer hospital-acquired conditions, higher patient safety indicator scores, and higher patient engagement scores. 3, patient and caregiver suffering are connected. When nurses recommend their organization as a good place to receive care, patients are also likely to recommend that organization. And then last, when caregivers are engaged, they feel that they belong, that they provide good care, and that they contribute meaningfully. In other words, nurses give to others who give to others receive in terms of their own resiliency and job satisfaction back. And interesting, as I've spoken about this topic around the country, most people, of course, resonate with these words and resonate with these stories. But I've had a few nurses, my own profession, who have pushed back and said, don't you know that we're overburdened, we're understaffed, there's too much to do in a day. We really don't have time for compassion. One ER nurse said, I save lives. I don't need to be compassionate. I know we need to improve our systems, and we need to help the managers and leaders support those at the front lines. I do understand that. But I will tell you, I'll be damned if nurses think this is not an important part of what they do. So it's very important to me to tell the story and to hold up Abby and Kathy as stark examples of how this can be done. Yes, they went above and beyond, perhaps, but research shows that you can connect with patients to convey compassion in under a minute.
Just like the trauma bay, healthcare at large is a well-oiled machine. Institutionalized medicine is positive and necessary in so many regards, but has negative, obvious ramifications as well. Too often, patients and their families are overlooked, and the emotional connections healthcare providers can offer are undervalued. Taking personal stock in such connections, I feel reinvigorated after connecting with Sue. There was no box to check off afterward, no deadline to meet, but the personal reward was well worth the effort. I am blessed to work in a position where I can be acutely reminded of how precious life is and how powerful small acts of kindness are. It truly is all about the little things. The secret is you can always find something that connects you, and once you do, it allays patients' fears, instills trust, and allows you to impart your information and care in a more compassionate and effective manner. One definition of compassion comes from Pema Chodron, who said, "Compassion is not a relationship between the healer and the wounded. It's a relationship between equals. Only when we know our own darkness well can we be present with the darkness of others. Compassion becomes real when we recognize our shared humanity." Also, I believe you should include measuring your success and whether or not you can make your patients smile. The notion that you shouldn't get emotionally involved disrupts your job satisfaction and will inevitably lead to burnout. As healthcare professionals, we are so fortunate to have careers that offer the most important kind of job and soul satisfaction by allowing us to connect with others and help our fellow man in times of need. So we should take advantage of this and do the little things. Hold the hand, speak the reassuring words, get the granola bar, stay in touch with someone who you have bonded with, and let the relationship continue to be a healing one. As I followed Sue's journey through loss, I saw what it meant to lose your soulmate, your best friend. My heart ached for her as she vividly recalled a lifelong love affair ended all too abruptly. And then my heart ached more as I asked myself simple questions. Was I partnered with my best friend, a soulmate, someone who would be rocked to the core if I passed? Was I living without regret? Was I holding back in important ways? When I realized the answer to these questions, I made radical life changes. I'm now happily married to my best friend, my soulmate, a man I met in Iceland while traveling abroad with new lenses on and what can only be described as an awakened soul. We have a 5-month-old daughter, Loa, and reflecting back, I know that the universe brought Sue and I together in a very purposeful way. It has been reinvigorating as a CRNA to know that as my education and career has progressed, I have not left behind the piece of me that inspired me to pursue nursing over 10 years ago. If anything, now, more than ever, I am committed to delivering competent, compassionate care and forging meaningful, beneficial relationships with patients and their loved ones. I am so grateful to have met Sue and her family, and to learn about what an incredible man Bob Hassmiller was, and to live my life more passionately each and every day because of this experience, which I will certainly never forget.
And I will never forget the kind of compassion these two unbelievable souls provided to me and Bob just when we needed it. As a family member and as a nurse, I can tell you that almost anyone can be a good nurse, a proficient nurse, a nurse who saves lives even. But to me, I believe a great nurse and a clinician is someone who also saves souls along the way. Abby and Kathy are great nurses. Thank you.
Thank you so much. Thank you. That's great.
Abby referenced the journal that she was reading along the way. For 1 year, I kept track of my feelings and my reflections along the way, what had happened, including the compassion journey. And so many people who followed that journey encouraged me. I've never written a book before, but encouraged me to publish. And I've seen it here. They rush printed it, and this is the first time I've seen it. It's called Resetting, and I hope that you will use it and use it along the way as well.
And that's how I found you, reading your blog.
Yes.
Yeah.
Yeah. Thank you.
And so much so you're picking out.
Yep.